when we were younger, right, with chickenpox. I had it during Christmas, and I remember that specifically because they didn't care. Everyone was like, "Yeah, join." So you're saying we shouldn't have any measles parties, though, right? Like, no, nothing like that.
Please, please, no measles parties. No.
Welcome back to another episode of Tired Parents Club. I am your host, Kevin Pinto, with my co-host, Sierra Langford. How you doing?
Hello. Good, good. So today we have with us Dr. Lindsay Duguay with Piedmont Medical Center, and we're here to talk about something that's back in the news. Why? Because cases have started to pop up. We're talking about measles. Can you please get into it? Talk to us like we have no idea what measles is. What? Why is this back in the conversation, and why are we seeing these cases?
Yes, measles is a hot topic and one that we didn't used to talk about. Measles was actually completely eradicated in the US in 2000, meaning there were no cases of measles. It wasn't being spread. And now we are seeing people come into the ER with rashes saying, oh my goodness, is this measles? So the question is, why is this happening? And it's unfortunately due to lack of vaccination rates. So
Mm.
kids throughout childhood, you go to the pediatrician, you get vaccinated. Some people can't for very numerous reasons. In order for measles to not spread, which is a respiratory virus, so we can get into that, you need to have herd immunity of 95%. So what does that mean? At least 95% of the population has to have been vaccinated to stop the spread. And we are down to seeing this in the 92 to 93% range in some kindergartens. So that's below the level that you need the herd immunity. And therefore, measles has started to have outbreaks and it's spreading like wildfire in some communities.
Mm.
Wow. So I guess, yeah. What do measles look like?
Okay.
Um,
So measles is a rash, but it doesn't start that way. So measles, it's a respiratory virus, meaning you get it from breathing in the infected air from someone else. Measles can actually hang out in air for up to 2 hours after somebody is in the room. So if you go to the grocery store, that person could have left 2 hours ago, but the virus is still in the air and then you're breathing it in and you can get measles. And you're actually symptomatic from 4 days before the rash to 4 days after. And if you're exposed to somebody, you might not get symptoms until 7 to 14 days after you breathed in that air. So there's this big lag time versus when you could have been in a store and not even know somebody with measles is there. And then 14 days later, you actually start with a fever. That's the first sign, which fevers are common for a lot of viruses, right? So with measles specifically, you can get a fever, red, watery eyes, runny nose, and a cough. And then this rash starts. And this rash is what we call maculopapular. It's a big word for basically red and splotchy and kind of flat. It has a very characteristic pattern that no other viral rashes have. So the measles rash actually starts on the head and it goes downwards throughout the body. It starts at the hairline and then it goes down the face, down the neck, down the chest, out into the arms. And then it actually goes away in the same type of pattern. It goes away from
Oh,
down
I did
also.
not know that. I
yeah,
did not
no.
know it starts at the head and spreads down the
Yes,
body.
it's the only rash that does it in that exact pattern.
So is it like chickenpox in any way? I guess people have kind of confused them sometimes.
Yeah, so from a medical professional, they're very different rashes, but
Mm.
they are rashes to, the general chicken pox. They're viruses, they make rashes, they get fevers, and you don't feel good, right?
Mhm.
However, the measles rash, it's that flat red rash. It's generally not itchy. Chicken pox is very characteristic. You get bubbles basically. They're called vesicles. So they're fluid filled and they're in different stages and they don't start head down. They're all over the body. They pop, they're itchy. So it's a very
Fascinating.
different type of rash, but they are both viruses. And
Okay, but
measles tends to spread faster and quicker than a chickenpox outbreak.
You bring up something that's super interesting that I feel like is constantly brought up when comparing measles to chickenpox. So, I had chickenpox as a child.
Me too. I saw scars.
yeah, same.
Yes, I was
I don't have scars,
born
luckily,
in the
but
80s, and so I had chickenpox, and that I feel like people are out there saying, "Well, who cares? Who cares if my child gets measles and it spreads? It's like chickenpox. Why, from your a professional, a doctor, tell us why should people take measles seriously if your child is getting measles? Why is this not like chickenpox?"
Yeah. People used to have like chickenpox parties. I
Yeah.
remember my mom talking about that and be like, it's almost like a rite of passage for a kid. And honestly, before vaccinations, most children also got measles too.
Mhm.
However, measles can have worse side effects of the virus and long term consequences than just chickenpox. Chickenpox are kind of miserable. You can get, some seizures from the fevers and stuff like that. However, measles can have some very bad side effects. You can actually get hearing loss from brain infection called encephalitis. About 1 in 20 kids can get hospitalized from pneumonia. That's the number one cause of actually death from measles. You can get pneumonia afterwards. The brain encephalitis, and it's as scary as it sounds. It's literally inflammation of the brain that can cause hearing loss, that can cause seizures. And then even more rare but more serious and characteristic of just measles, years later, after a kid recovers from measles, you can get something called SSPE. It's a fatal brain disease from it. So it's something that measles is preventable. It's 100% preventable, and it can cause some very serious side effects and problems if you end up getting it.
Now, have you watched The Pit?
So I work enough here. I didn't want to watch it when I go home and be on my work day. So
That's
I'm one of the
fair.
few that probably hasn't, but I heard it's a great show.
I don't know. I still work in news, but I've watched the newsroom. That's a little bit
Do
different.
they
But
address the
Touche,
measles?
touche.
they do. And maybe you heard it, right? There was an episode where they talked about that, and the
Mhm.
kid ended up getting encephalitis. I can't even
Okay.
say it right. Encephalitis.
Encephalitis. It's a
there
bad
we go.
word clinically, and if you get it.
Yeah. So it's real. So and that's why I like The Pit too. My mom works in the medical field, so she'll like vouch for it and she'll be like, that show's actually probably one of the more accurate, like, hospital beat shows.
Maybe I'll go home and watch it.
Nah, I sold it to her.
Snap too hard.
Well, and
It's really good, and they don't mind showing everything too. It's a great show.
Well,
Anyways,
when talking, and you address the early symptoms, right, of measles, it sounds sneaky, like kind of presents itself as a cold at first
Mhm.
before the rash appears.
Exactly.
well, and you said it's in our head too, right? So is it just hidden behind our? It could be hidden at some point too.
It doesn't stay hidden for long.
Yeah,
You'll
yeah,
see
okay.
the rash on the rest of your body, but it kind of starts at the hairline. And one other thing that's pathognomonic, meaning no other diseases have this, is something called Koplik spots. They're little white dots inside the mouth that can happen from measles too. So that's also. So if somebody comes in saying, is this rash measles? We have testing we can do to check, but there's also some signs and symptoms that can point us to say, this is probably measles.
Gotcha. And then we're talking about when we were younger, right, with chickenpox.
Mhm.
We got it. I had it during Christmas.
Mhm.
And I remember that specifically because they didn't care. Everyone was like, "Yeah, join." So you're saying we shouldn't have any measles parties, though, right? Like, no, nothing like that.
Please, no measles parties. No. If there's one takeaway, it's consider vaccination and no measles parties, please.
No measles parties. Got it.
No, I'm just going back to just talking about the spread of measles, and it sound just how contagious it sounds like this.
Yeah.
It is the
Very
fact that
contagious.
it can stay. You said it could stay in the air for up to 2 hours.
The airborne quality of measles is one of the things that makes it so contagious and spread so rapidly. Because again, you go out in the public, you're in a store, that person could have been there 2 hours later. You walk in, you have no idea. And again, that person might not even know that they have been exposed to measles because you don't do your symptom, or you can spread it, I should say, 4 days before you get the rash. So you might think, I just have the common cold, the fevers, the runny nose, sniffles, and it's actually measles. You just haven't gotten the rash yet. So it's serious.
I thought I read something. This is just, again, quick research, but they said like people before the 1956 or something like that you're immune to it because I guess they already had it. Is that also
So if
like
you
that?
have gotten measles, so there's two types of ways to be immune to measles. There's natural immunity, meaning you got it at, not a measles party you're going to need to go to, but you've had measles. So then you are immune to it. Your body has produced, the antibodies that if you get it again, your cells in your body, without getting too medical, will attack it. And then, so that's when you get vaccinated throughout childhood. And so with the vaccine, it's in the MMR vaccine. So it's joined with measles, mumps, rubella. So MMR is how you're going to get immune from the vaccination for measles. And one dose provides 93% immunity and 2 doses provides 97% immunity. So now you're above that 95%. So that's what you need, the 2 doses basically to really have that herd immunity to not spread it.
Gotcha. And that's why they say the 1950s, right? Because that's when the vaccine came out.
I think 1961, don't
Around
quite
there?
quote
Oh,
me
yeah,
there.
yeah.
So the early 60s, it's been around for decades. So there's lots of safety data behind this vaccine.
Okay, sweet. Let's take a quick break because I know I'm excited to ask more questions. So we'll be right back.
Same.
Welcome back to Tired Parents Club, where we are talking about measles, pretty hot topic these days. So I mean, in South Carolina, I thought we're almost at 1,000 cases, is my understanding for measles, or at least confirmed.
Since
Um,
December.
yeah, since December, or yeah, it might have been earlier. I don't know. Honestly, I thought I saw even October. Because
Mm.
North Carolina's starting to get some now too, so it's definitely getting here. But then I also read something like 20 of them were still vaccinated. So you mentioned the percentage of vaccination. So is it still possible, even if with the vaccine?
It's still possible because, like I said, 2 doses is 97%, so there's 3% of people that can still get it, and 1 dose is 93%, so 7% of people, if you've only been vaccinated once, can still get it. So it's not 100% foolproof, not much is in life, but, it provides a significant percentage coverage in a good way.
Mhm.
I got you. So I guess doctors do recommend. I know this is always a hot topic, right, with vaccines. So I mean, again, your professional opinion is do you recommend vaccines
Yeah,
or this
so my
vaccine, that
job is
is?
not to judge any parent in any way. So my job is just to give the facts, right? So the vaccine, as we briefly talked about, it's been around since the early 1960s. There's decades of safety data behind this vaccine. All my kids are vaccinated, and we know that it does prevent herd immunity. And there's some people that are immunocompromised, say they're on chemotherapy for cancer. They're very, very young. They're not old enough to get the MMR vaccine, the first couple months of life. It protects those people. So you're protecting the other people that can't get it. Maybe they have an allergy, a true allergy to a vaccine, and they just can't get it. So you're protecting those other people too. So yes, I recommend it.
Well, because I got vaccines for Lila,
Mhm.
I'm I'm a little less educated. I'll be real about that. A lot of moms, a lot of parents, I feel like they're really doing their research on vaccines, and you believe what you believe. Personally, I leave that to my wife. Unfortunately, as a
And I think any
classic
parent,
dad.
whether you get it or not, no, everyone in their heart, they're trying to do the best thing for their child, right? So, I mean, that's the most important thing. We want to make sure we educate you to make the proper informed decision for your family and, help you if you do end up getting these things. Hopefully you don't.
Yeah, true.
With the vaccine, what are the recommended age? So when you start to get your first dose,
Yeah.
what are
So
they?
within the first year of life, you'll get your first dose, and your pediatrician has a specific, recommendation by the CDC when you're supposed
Mhm.
to get the actual vaccination. So you can't get just, I said about you need 2 vaccines to get 97%. You can't have one on Monday and one on Wednesday. There has to be a
Mhm.
time delay so your body starts to get the antibodies to that vaccine afterwards. So it's all based on medically looked at criteria about the vaccination schedule.
Are measles more dangerous to kids or as an adult as you get older? Is this another thing where if you're 80 years old and you got the measles, I mean, this is going to be really bad, or where is it worse for?
Measles can be bad for any age group. It's not one particular thing, but if you're already immunocompromised or you have some other medical condition that you're, on a lot of medications for, if you get it on top of that, that's more serious. If you're, young, healthy, you can still get the complications. Nobody knows and can predict who will lose their hearing, who will get brain encephalitis or pneumonia. So it can be dangerous for anyone, but some
Mm.
certain groups more dangerous than others.
Does the rise in cases concern you?
It does concern me, yes, especially for little kids who haven't been able to get vaccinated or other people in those groups that we mentioned. So anytime there's an outbreak of anything, as a doctor, you start to get worried.
Mhm.
If you do get exposed to somebody and you know that they are positive for measles and you get symptoms, you can actually get the MMR dose within 72 hours of exposure, or something called immunoglobulin within 6 days. So even if you haven't got the vaccine, we do have options, not specifically from the ED, but from family doctor and other areas where you can actually still get vaccinated.
What's the recommendation for families who, okay, let's say worst case scenario happens, or my child gets the measles. I've
Yes, we
seen
do.
the next recommendation is quarantine, right?
Yes. So that is so basic things first, without getting the MMR within 72 hours is an option, but
Mm.
definitely quarantine. And don't just show up to the family doctor's office. Please call ahead because, again, we need to have airborne precautions and we need to make sure because it does just hang out in the air. So you don't want to expose more people than you need to. So if you are concerned, let your family doctor office know first. Quarantine at home. Please don't go out shopping and everything and exposing other people, and then symptomatic control too. So just like other common, well, not that this is common, but other viruses, you get fevers, Tylenol, Motrin, runny nose, dehumidifier, good hand hygiene, all that kind of stuff, increased fluid. So some of the same symptomatic control that you would do for other viruses as well.
And and that's what we've seen too with the outbreak in Spartanburg County, South Carolina. That's roughly an hour away from Mecklenburg County. And we've seen with these, we obviously don't North Carolina doesn't have as many cases as South Carolina, but we have seen with these cases, we get a list from the health department of, these are the locations where there could be a potential exposure, where they've said this person who has measles has been here, 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 and here. And not to say, oh, you're going to get measles if you go to this
Yeah.
location, but they were there, potential exposure. So
Yeah.
it's,
Well, that's the thing. People travel a lot, right? We don't
Mhm.
know who's been where. So, and
Mhm.
not to make this scary for anybody, but you don't know where people have been or who's been around or
Mhm.
exposed or not. So
Mhm.
again, at the end of the day, vaccination is the best preventative measure to not even have to worry about this
Mhm.
in general.
Well, and that's just like any virus, right? I mean, you can't. It's hard to track once it's out there, once it's spreading.
Mhm.
The best you can do is just kind of prevent it from spreading, doing the best you can by
Mhm.
staying in your home. If you feel any kind of sickness, usually I feel like, especially when you know something is spreading
Yeah,
like
yes.
measles.
If you're not feeling well, just stay at home. Take care of yourself. Cover for anything. That's any illness in life.
Gotcha. We're gonna take a quick break. We'll come right back and talk more about measles.
Hi, welcome back to the Tired Parents Club. We're talking about measles. I'm going to get right into it. What do we do for families out there who are concerned about the MMR vaccine or who have hesitancy with that? How do doctors handle those situations or those conversations with families?
Yeah. Yeah. It's not just the MNR, just kind of vaccines in general.
Mhm.
Is hard. Trying to do the right thing for your kid, it's hard on many, many levels. So I think parents are really just trying to do the right thing again for their kids at the end of the day. So when we're having these conversations in the ER or otherwise, it's first validate the family's concerns. And then again, just go on medical facts. That's really my job at the end of the day. Not to convince one way or the other, not to judge, but really just present the medical facts and how it can be helpful, any potential risks, harm, side effects. And then at the end of the day, just be there as a support person to that family to answer any questions and ultimately, help to guide them in whatever decision is right or needed for their family.
Do you think we're getting a lot more pushback for vaccines these days only because I guess there's more access to people to look? What do you think?
So I do. There definitely is a lot more pushback. Again, measles was eradicated in 2000. There were no measles cases. So the pushback is definitely bigger, and social media is also bigger. So that information, false or true spread, is a lot faster and more common these days. So yeah, I think that has a lot to do with it.
Yeah, and the best you can do is just educate, and then
That's
people will
it.
make their
That's
own
it.
call.
Yep. Not going to convince somebody who has completely made up their mind in general.
Yeah, that's fair. Cool. Any final thoughts on measles?
No, it can be scary, but we're here for you. There's ways to prevent it. And if you get it, take care of yourself, quarantined, and we're there for you too.
Perfect. All right. Well,
Love
thank
it.
you so much. That was very knowledgeable and super helpful. Now I know more about it for sure, and I hope that everyone watching has a better idea of what to worry about with measles now. So, yeah, thank you for joining us, and we'll be back for another episode of Tired Parents Club.
Queen City News Plus. Just search Queen City News on your smart TV's app store.